Hi, it's Tom here from Running Physio, and in today's video, I'd like to talk to you about 6 key phases for calf strain rehab. And this is going to be based on some brand new research, really excellent research from Green et al. 2022. Now, this was a study that actually was qualitative in nature. They interviewed 20 top experts in calf muscle strain injury, and they really delved into some of the key things around assessing and managing calf strains and guiding people back to return to sport successfully. Now, I'll put a link to this in the comments. Do check that out. It is open access. It's a bit of a gold mine of clinical gems. So it's a long one. It's nearly 30 pages long, but if you've got a bit of time and you fancy delving into this in more detail, I really would give that a read. So I'm going to give you some of the edited highlights of that new research and hopefully make it useful for you if you're seeing people in a clinic with calf strain injuries. Now, this research is based on elite athletes, so we have to bear that in mind, but I'm going to try as we talk through it to make it as relevant as possible to people that you'll see. And for once, it isn't just about runners. So this is going to be relevant to basketball players, people in ballet, rugby, football, as well as runners, sprinters, etc. as well. So shortly we'll be talking about these key phases that they discuss in the rehab and what you might want to address in there. First, there are a few gems I wanted to delve into from the paper. Now, before I forget, I also want to let you know we've got our excellent selection of different injury videos available for you on the Clinical Edge website that I've put a link to there. We've got ones on iliotibial band syndrome, lateral hip pain, lower back pain in athletes, and Achilles tendinopathy. So do check those out. So yeah, let's think about some of the useful stuff we can take from this paper. So first up, they talk about the assessment process. Someone comes in with a new calf muscle strain. What are some of the things we might be thinking about with them? And they talk about being able to differentiate initially between a gastrocnemius injury and a soleus injury. Now, a lot of the time, I think we tend to blame the gastroc. We know particularly medial gastroc injuries are very common, and these soleus injuries can kind of get missed. Now, the key things they said to look out for is that with a gastroc injury, you might expect that kind of shotgun effect, like someone's been shot in or kicked in the back of the calf, sudden onset, sharp pain during a game, potentially in a position where there's high demand on the calf, perhaps like pushing off during tennis is a common example. So they get sudden onset, sharp pain, usually quite specific and well defined. With a soleus muscle injury, though, they're often a bit more vague, less well defined, and the athlete might describe more of a tightness or cramping sensation that gradually builds up during their sport. Now, the gastroc injuries are more common in our sprinting, basketball, rugby, football, etc., whereas soleus injuries are more common in our endurance sports, particularly our long distance running. And the differences in diagnosis here may affect some of your management. It might be that for a soleus injury, you particularly want to pay attention to exercises with some knee flexion involved. So calf raise work with some knee flexion, like seated calf raises or bent leg calf raises, to make sure we're trying to hit soleus a bit more. But also, we may want to look at how we return to sport slightly differently, because they say in this paper that these soleus injuries are more related to training volume, so how much you're doing. So they urge a little bit of caution coming back to high volume training too quickly. Whereas perhaps gastroc is going to be a little bit more related to training intensity and loading that calf in a stretched position. So we may be more cautious in bringing those back in. As ever, of course, it's going to vary based on the individual. So I thought that was quite a useful thing for us to be thinking in the early stages. They also made a point which I completely agree with, in that it's a good idea in that first session to have a quick look at the lumbar spine, look at range of movement, look at straight leg raise and slump, because there is often a neural component to calf pain. So if we miss it, it can often go unaddressed to the later stages. And also, if you think about this too from your differential diagnosis point of view, if you've got a runner who is getting a gradual development of calf pain during running, it is possible that that is neural in origin. So it is worth thinking outside the box a little bit there and checking the lumbar spine. Now, they also mentioned a number of different things that we would want to look at early on in our assessment of calf pain that can be quite useful prognostic indicators and quite useful markers as we go through the rehab. So this includes things like pain-free walking. If someone's able to walk without restriction quite early after a calf muscle strain, that is a good sign. That tends to suggest a better prognosis. If, however, you see them coming into clinic on crutches, barely able to get their heel to the ground, you know that perhaps this is going to take a little bit longer to get better. Now, of course, every one of these signs on its own won't tell you a lot, but a collection together is going to be useful. They also talk about looking at palpation tenderness. This can help us to see how the injury is progressing and also help us to get some idea of the injury location. Is it medial gastroc? Is it soleus? Is it the musculotendinous junction potentially? So that palpation tenderness can be useful. Stretch tolerance and range of movement are also important, and these are things that are often restricted in the early stages. People struggle to load into dorsiflexion when it's very sore. Single leg calf raise strength also very important as a prognostic indicator and to tell us when we feel people might be ready to progress their rehab and progress towards running. And then plyometric function, another test too, might not be appropriate in the early stages, but as you progress through, you want to check that the calf is able to function plyometrically and have a progression in mind there with your testing. Perhaps starting with easier stuff, perhaps some two-leg work before progressing on to more challenging plyometric activities. So these are some of the things that we might look at through the rehab process for signs of prognosis and also for signs of progress. Now, another thing I like about this paper, and as you can probably tell, I thought it was a real cracker of a paper, is that they talk throughout about individualizing rehab and what that means. And I'm all about that. I think it's so important. So it's thinking right from the start is what are the demands of this person's sport. You think about a rugby player, for example, who needs to get in that scrum position and load the calf in that position. They're going to have very different rehab needs from a long distance runner who isn't going into those positions, who doesn't have to manage external load. And that long distance runner's rehab needs going to be very different from a sprinter who needs to manage very high peak loads, but for a short period of time. So right from the start, we should be thinking, how might we adapt the rehab? So from the earliest possible stages, we're preparing people for the different demands of their sport, but also adapting it to the individual and some of their more intrinsic factors, perhaps, particularly things like age. Probably people older athletes with a calf injury, maybe they come in with a weaker calf to start with because we do see a decline in calf strength with age, particularly in men, and it may take them longer to rehab, as it will do with people with previous calf injuries or more complex presentations. So those things should be on our mind from the start as we go through these phases as well. Some food for thought for you there. So let's delve into these 6 phases that they discuss in Greener Tool's paper. Now, phase 1, after completing a good assessment and getting a good idea of this person's rehab needs and what their goals are, is going to be looking at early loading. Now, they stress in the paper that we want to load the calf complex as early as feasible for patients. And they suggest, if we can, to do some form of single leg loading early on and look to adapt how we do this based on tolerance and patient symptoms. So we know many people are not going to be able to go off and straight away do multiple single leg calf raises on the step if they've just come in with a calf injury. But might we be able to get them to do some isometric work on that single leg potentially? Might we be able to get them to work in varying different ranges isometrically, or isolate just the eccentric component potentially? What can we do to get some isolated calf work early on to start restoring strength and range of movement? And then think about the other muscle groups that might be implicated. There does seem to be a connection between the hamstring, for example, and calf function. Calf potentially being a bit of a weaker knee flexor. So can we do some work potentially for the hamstring or other muscles up the kinetic chain in those early stages if we're restricted in terms of what we can do with the calf? And even in those early stages, can we think not just in straight lines with our movement? You think about a sport like basketball, like football, like rugby, it's very multi-directional. So can we introduce some form of sport-specific movement early on, whatever's manageable for that person, that starts to get them moving in ways that they might do with their sport? So the early loading is all about trying to get some load through the calf in whichever way is manageable, work other muscles that might be relevant, and start some form of sport-specific movement, whatever you feel that might be relevant for that particular person. Phase 2 is loaded strengthening. Now, this hopefully, as we're getting through the rehab phases, we're finding the person's less irritable, they're able to tolerate more load. And we really want to then try and progress them to loading through range. Now, this is an important part of calf strain muscle rehab, and it's often one that's neglected. We need to get them loading at length as soon as they feel able to do so, really. And again, if we can, getting them to do that single leg. If not, I do still think there's value for double leg work if single leg's not tolerated, but can we get them to do something single leg, even if it's just a few reps, and work them through range to try and develop their strength? And again, we might focus on specific needs of the sport. So, for example, a ballet dancer that needs to be on point, they need to be strong in that end of range plantar flexion position. So might we choose to do loaded work, isometric work, strength work that takes them right the way through to that position of being on point? For our rugby players, they need to be able to tolerate those scrum positions to push from deeper dorsiflexion. So can we make sure we load them through into that range? For our runners, if they're doing hill running, they absolutely will need their dorsiflexion back. So can we make sure we include that? So in phase 2, it's about strengthening, loaded strengthening, working through range, and then progressing by developing more load to prepare the calf for the demands of the sport. Remember, the calf muscle manages very, very high peak loads, even in just endurance speeds. We're looking at 6 to 8 times body weight with each foot strike. So we do want to try and load that calf up to prepare it for that and hopefully stimulate good healing within the tissue at the same time, because we know if we're loading that tissue, hopefully we're developing healthy, strong, flexible scar tissue that's going to function well further down the line. So that's step 2, loaded strengthening. Step 3 from Green et al.'s paper is more about power and plyometrics. Now, this is another very important function for the calf. It's got to be powerful. It's got to be able to produce force very quickly. And again, it can be neglected for people in sport. And think again about the demands of the sport and the individual. So the calf is going to be involved in acceleration and deceleration. It's going to be involved in vertical force production and horizontal force production as well, and it's likely to be involved in change of direction too. So we may want to replicate that with our plyometrics and our power work. But think about how we progress it. Might we start from small excursions first of all? So things like perhaps skipping or pogos, where we're looking at small movements in place, or jogging on the spot on the toes, just getting used to some of that more kind of elastic plyometric loading before going on to larger excursions, as they talk about in the paper. So perhaps onto things like forward jumps, forward bounds, and forward hops. And again, you can look at a progression there in terms of going from double leg work to going from one leg to the other, and then finally onto single leg work, and thinking about side to side work, cutting, change of direction, etc. Always going to be about what that person needs in their sport, and coming back to that sport specificity as soon as you feel able to do so. Now, we're starting to work through these phases. Hopefully, we're getting to a point where they're non-irritable, and it's the correct phase for bringing in power and plyometrics. So you need to have the range and the strength to do that, really, and be at the right stage of their recovery. So that would be step 3. Now, step 4, they call locomotion. And I really like this phase in this paper because it's talking about preparation for return to running and return to sport. And again, not just thinking about saying, right, you're at the right time scale now, go and run, but thinking, how do we prepare people for this as soon as possible within their rehab? So can we get them walking and then brisk walking? Can we get them doing stair climbs and brisker stair climbs to get them used to those movements? Can we get them to do walking lunges, perhaps bear crawls, whatever's relevant to them, but gradually building up this calf, getting it loading through range in multiple different ways and multiple different directions to prepare it then for our return to running process. Now with that, as we touched upon earlier, perhaps in a case where we're looking at someone with a soleus injury, which may be more endurance related, we may not want to start bringing them back into very long duration running. We might actually want to break it up and keep it shorter and be a little bit more cautious about how we progress volume. With a gastroc injury, perhaps we're looking to be a bit more cautious about how we progress intensity. But remember, faster running generally means more stress on the calf complex. So I think it's fair to be a little bit cautious with both. We also want to have some return to running criteria. So they want to have good strength with your strength tests, to have full range of movement, I would say, to be comfortable walking for at least half an hour, to be able to jog on the spot for at least a minute without any pain. And these are good indicators usually that the calf may well be ready for something a bit more challenging. We might also want to take them up to hopping repeatedly to make sure they can tolerate that before gradually building in the running and then gradually building up that intensity and volume based on the individual goals. And again, here you can be as specific as you can. You think about a winger on the football pitch. How many times during the game have they got a bomb down the wing at top, at high speed, doing that, not quite sprinting, but high speed running, stop, change direction, come back for the defensive phases. So those are the things you want to try and get them to start building into, even on the football pitch, looking at them going up and down those wings and starting to build up the reps, the intensity to prepare them for return to sport. Because we know we can't go from nothing to 90 minutes of football without any of that preparation. So that's going to come in this phase, hopefully. So phase 4, locomotion, preparation for return to sport. And then phase 5 is actually the return to sport phase. And they talk in this paper about making good decisions around return to sport. Making sure that those prognostic indicators that we've talked about have all progressed appropriately. We're no longer getting palpation tenderness. They've got full strength, full range of movement, good plyometric activity. They've been through the challenges of their sport and they've succeeded. And one of the ways they talk about this in this Greener Tool paper is, if you're looking at team sport, have they been through full training sessions that would challenge them for the demands of their sport without any reaction? If so, then it might be appropriate to bring them back into that competitive environment. Or if you're looking at someone with multiple calf injuries that have had maybe a failed attempt before, we want to be a bit more careful. So can we repeatedly expose them to those training conditions to get them 100% ready before bringing them back into the game? And then in that game environment, can we start with a graded exposure too? Can they come on late on as a sub for the last 10-15 minutes, then progress towards half an hour, a half, or into a full game, or get some work done with the reserves or under 23 group, or whatever's necessary to really prepare the person for the demands of their sport. So that's an important phase. Now you might think that's phase 5, we're done. I'll get my coat, we can finish now, we've got them back, we've succeeded. But there's a very important phase in this, the final phase, which is athlete monitoring while they've returned to sport. Now, they make a very important point in this paper that around about 50% or more than 50% of calf strain muscle injuries suffer a recurrence. And it's common for that to happen during rehab or during the return to sport phase. So it's important that they're monitored during return to sport for roughly 2 to 4 months, they talk about in this paper. And it's not just a question of monitoring as the wheels fall off and something goes wrong, but looking at how they're getting on with the training, how they're getting on with competition if they're involved in that. Are they getting symptoms? Are we starting to see some of those prognostic indicators change? Is their calf strength reducing, perhaps because of fatigue? Are they tightening up in the calf? Are they getting a bit of palpation tenderness again? Are their plyometrics tests starting to struggle? If that's the case, they're developing symptoms and things, then we need to respond. Back off a little bit, focus a little bit more on recovery, load manage to help keep them doing the sport, but ensure it's at a level that they can cope with. And that way, hopefully, we can get them back and keep them back and reduce that risk of recurrence. So, as a really nice paper on a calf muscle strain injury there, I do recommend having a read of that because there's loads of gems to take away. There's more specifics in there. But just to whiz through those 6 phases they talk about. Phase 1 is early loading, trying to get some load through that calf complex in as however you can really in those early stages as tolerated. Phase 2, loaded strengthening, progressing through range, progressing by adding weights, considering the needs of the individual and their kinetic chain. Phase 3, developing power and plyometrics, again specific to the need of the sport. But phase 4 is locomotion and preparation for return to running and a graded return to running and sporting activities as well. Phase 5 is the actual return to sport phase, setting criteria that someone needs to achieve before gradually bringing them back into their sport. And phase 6 is monitoring their response and adapting their training and sport accordingly to keep them back and reduce the risk of recurrence. Okay, thank you very much for listening in today. I hope you found this useful for lots of different people that you'll see in clinic that will come in with calf injuries. Let us know what you think in the comments. Are there any things that you would add in? Anything that you think gets neglected in calf strain rehab? Any problem patients perhaps you've encountered with calf pain or you haven't got the results that you would expect? And as I say, if you'd like to learn more about running injuries, do check out our free injury videos that are available on Clinical Edge. There is a link in the title there for you to do that. And I look forward to speaking to you again very soon. Thanks again for listening. Bye for now.